Ontario will begin offering rapid COVID-19 testing for schools in areas with high risk of transmission. The province's top doctor says the strategy will help to identify cases and to prevent school closures.
We want to keep schools open. All medical officers of health are in agreement that schools should be the first to open and the last to close. And this is an extra tool in our tool chest to keep schools open and to have the antigen tests accessible and available if we're seeing a school that's in trouble, that's having consistent cases, that's at risk for closure. This is an extra tool to keep our children in the classroom.
For reaction, our Chase team has reached Dr. Anna Banerjee in Toronto. She is an infectious diseases specialist and pediatrician. Dr. Banerjee, what do you make of that rapid testing in some areas to try to keep kids in school?
I think it's a good idea if it's targeted. We have about 2 million kids that are unvaccinated in school, and to test all the kids, it's not a very good use of resources. But if there are certain schools where there's a high prevalence of COVID in that area at that time, or there are schools having outbreaks, then this is something that they can use to try to identify additional cases of COVID and keep them out of circulation. So it makes sense in a targeted way.
And what makes an outbreak? And who calls for these tests?
So I guess those are things that need to be discussed. I think, from what I understand, it sounds like it's probably going to be in collaboration with local health units and local school units, but I don't really know. A lot of those details I don't believe have been given yet, but I think that there may be thresholds if a school is continuing to have outbreaks and they're having a hard time keeping kids in school because it's or a school is potentially at risk of closure. Maybe at that point they would implement this, but I don't know the details.
We'll be watching for all of those details, and we're putting some of those up in notes on the screen for our viewers right now. We know those tests will be conducted at home. If they're negative, the kids can go back to class. What is the problem with false positives with these tests, though? Have you come across that?
I think the issue is more false negatives. False positives are occurring when you've got very little COVID out there, and then if a test is positive, it's more likely to be falsely positive. And that, for a false positive, that keeps a kid out of school. The issue is really, for me, false negatives. We know that the rapid test is about 50% effective as the PCR test, and we know that the PCR test doesn't pick up all cases of COVID. If a child is exposed to COVID and it's very early and they're in the incubation period, or it's later, but they're still infectious, but they have no symptoms, or if the test is not done properly, often you can get this false sense of security of that child doesn't have COVID when in fact they may. But having that versus nothing is better than nothing, right? So.
What do you say to schools, because you mentioned it would be inefficient to test every kid. It would be expensive to rapid test every kid in every school. So what should schools be doing? What measures should they be employing right now to try to keep their students and staff safe without being one of the high-risk schools and calling in the rapid testers?
So as we've talked before, masking, they should have improved the ventilation in the schools, distancing, limiting schools sizes, trying to cohort kids. Those are all things that they can do, and also making sure that anyone who's eligible to be vaccinated can be vaccinated. So making sure that teachers and custodians are vaccinated. I know that there's some controversy about that, and it's still not yet mandatory in schools, but that's something they could do. Also trying to vaccinate all the people around that child, so that all the adults at home, especially people who are vulnerable, they get vaccinated.
Right.
And that way, if there is COVID in the schools, at least it's not spreading to the communities. And what you're seeing right now in Ontario, we have 500, it depends on the day, 500, 600 cases, but it's not the thousands of cases that we're anticipating. And a lot of that is because, a third of the cases right now are in children, but a lot of that is because the adults around the children are vaccinated. So it seems to be working.
I want to thank you for your time, Dr. Banerjee. We'll probably talk again as we get further into this school year. Dr. Anna Banerjee is an infectious diseases specialist and pediatrician. She is in Toronto.